We just had our month with Elliot on the neurosurgery rotation, and it got me thinking a little bit about reflecting on my time as a medical student and putting myself back into Elliot's position, and what would a medical student do to have a successful surgical subspecialty rotation experience, and maybe even in particular neurosurgery. I think that maybe compared to some of the other rotations, the surgical subspecialty rotations are the most intimidating. And you get some of the biggest egos in medicine, honestly, in surgical subspecialties. Also, the operating room is its own unique environment. And I just think that there's a level of trepidation that goes into it. So I think that if you're on a surgical subspecialty rotation, you probably should have had some experience in the operating room. The ability to know how to scrub in and to respect the sterile field and understand the basic flow of the operating room, what the circulating nurse is doing, what the scrub tech is doing, and what basic etiquette in the operating room looks like. If you haven't had that in your training and you're going into a surgical subspecialty rotation, that's probably the most important thing to do. I think that it is impossible to know everything that a surgical specialist knows, as it is impossible to know everything that any of the rotation directors and physicians know. So there's no expectation that you are going to know everything. But I think that you should at least learn something. And Elliot did a good job with this. I noticed him reading, engaged, interested. You may or may not be that interested in the surgical subspecialty, but the providers that you're working with that are taking some time for you to be there want to see that you are interested in what they are doing. Not that you have to ask a million questions, but that you are engaged. You have a basic understanding of what's going on. Why are we going to the operating room? What's the diagnosis? And what exactly are we doing? And then doing a little bit of reading to try to understand a little bit more. And I think that each day on the rotation, if you can learn 2 or 3 things that you didn't know at the end of the month, you've really learned something. I do think that medical students, especially in large academic centers, should consider doing a couple of private practice rotations, because there's a different approach to medicine in private practice than in an academic setting. And my experience in medical school and in residency was wonderful, but it was the experience I had in residency, which was that the private practice group and the academic group had recently merged together. So we got the exposure of both, and there were strengths in both areas. And so if you're considering different rotations to do, don't be afraid of surgical subspecialty, and consider looking at people that are in a private practice setting, because you might get a very different experience in that. I think in the 3 or 4 weeks that Elliot was with us, we did like 75 surgeries. And that would be unrealistic to expect to see that many cases in an academic setting if you were with one surgeon. They just don't do that many surgeries typically. And then when we were in clinic, we would see a high volume of patients in a day. And some clinicians in the academic center and private practice have a nice process for clinic to manage that. So I just think that my recommendation would be make sure you understand the flow of the OR and go into it with an attitude of just trying to learn every day and then engage with the team. And I think that hopefully you can have a good experience with surgical subspecialty, and who knows, maybe you'll decide to go be a neurosurgeon or one of the other specialists.